welcome you to your Support in Action, Direct Services, Medication, and Treatment. It's good to see and sense that you're all here on the Zoom. So I hope you're all having a nice start to the summer. And it's wonderful to be sharing lunch, this lunch hour with you today. I understand that we have many new angels and visionaries who are joining us. And I look forward to knowing you and having the opportunity to say thank you and welcome in person soon. So today, I'm excited as members of the Broadway Cares Angels and Visionary Circle for you to join us as we open the virtual doors of our office to a conversation focusing on the direct services that you, each and every one of you, help provide to folks living with AIDS and other debilitating illnesses all across the country. Now, today, we're going to hear from three remarkable organizations, three longtime Broadway Cares grantees, and learn more about how your support and enthusiasm and engagement provides medication and treatment to hundreds of thousands of folks across the country. Indeed, making very true catchphrase that we wrote 30 years ago. What we do together makes a difference, because how you join us in our fundraising efforts means you are an integral part of our grant making. We'll also be joined by Broadway Cares Major Gifts and Planned Giving Officer, Nick Mayo, to moderate this conversation. So, in true showbiz parlance, let's get this show on the road and begin. Our first guest is joining us from the Callan Lord Community Health Center, based in New York City, right down on West 18th Street, in the heart of Chelsea. He is the Associate Director of Medicine for Adolescent Medicine and has been the Clinical Director of the Health Outreach to Teens, what is called the HOT program, H-O-T-T, since 2015. He provides care to youth aged 13 to 24 years, with a special interest in HIV treatment and prevention, sexual and reproductive health, and transgender health. He lends his expertise to many research studies and has collaborated with New York State Department of Health AIDS Institute to provide guidance for the care of adolescents at risk or living with HIV. Please welcome from Callan Lord, Yuri Belkine, and our moderator, Nick Mayo.
Hey, Yuri.
Hi, everyone. Thank you for having us here.
Sure.
So happy that you're joining us. And so you're joining from, where are your offices in Manhattan?
So we're at 18th Street. We're 356 West 18th Street, between 8th and 9th Avenue.
Amazing, amazing. Well, I want to jump right in. Callan Lord, obviously. Tom, would you like to give just a little history before we jump into the HOT program about Broadway Cares and the support of Callan Lord and how that came to be?
Sure. I mean, Callan Lord is one of our longest grantees. We began funding Callan Lord literally in 1994, soon after the merger of the two organizations, part of our original grants, our national grants program. And I think that first grant was for $5,000. This past March, actually, we awarded Callan Lord, and specifically the HOT program, a $40,000 grant. And over these last, I guess it's 28 years, if you do the math, Broadway Cares has awarded Callan Lord over $650,000. So they are a long-term partner of ours. I was actually on the board of Callan Lord for a number of years, 10, 12 years ago. But they are an integral piece of the healthcare system to the LGBTQ community here in the city, across the city.
So Yuri, with that wonderful support that our esteemed guests who are here, the support that you're making possible, what does that support specifically for the HOT program go towards making possible?
Well, we see about 1,500 patients a year, give or take. And about 50% of the patients that we see in the HOT program are uninsured. And, even those that are uninsured, that if they have high copays or whatever, The services we provide on HOT are at no cost sharing, right? So we will bill insurances when we have the opportunity to do so, and we'll help our patients enroll in insurance because in the end, that's what's better for them. But there are a lot of services that we provide that we do not bill for. And that includes, case management. We provide, obviously, again, free medical care, including, blood work and lab test, and also medication from our pharmacy, right? So patients that have no insurance or again have a copay, if they pick up their medications at our pharmacy, they don't have to pay any of their money, right? This also allows to have a youth model of care where we spend a little bit more time with our patients, where our patients are more engaged with our case managers, our care navigators. We provide therapy, we provide psychiatry, and all of those services again are at no cost to our patients. We also have a mobile unit. We have a mobile clinic that goes through different sites in the city. We've been to all the 5 boroughs, and usually it's drop-in centers for homeless youth, where we also provide our services free of costs. So there's, every little part of that is possible thanks to donations like the ones we receive from Broadway Cares from the support.
And Yuri, how long have you been with the HOT program? And for those of you who might not know, what does HOT stand for?
So HOT stands for Health Outreach to Teens. And, we clearly see more than teens. We see young adults, but it's just such a great name, right? Our logo is like, being healthy is being hot with 2 T's, and we're hotties with 2 T's. And so we kind of love it and refuse to let it go. I've been here for about 7.5 years. So I started in 2015 in January, shortly before the regulations changed to forbid exclusion of transgender coverage through health insurances. So it was at a time when a lot of our patients really were able to actually access a lot of services outside of our doors, thanks to being able to get that type of coverage. But the care that we provide, again, continues. It just allowed us to see a few more patients, and we continue to grow yearly, thanks to those changes.
So over the past 7 years with your time at HOT, obviously you've seen things change drastically. How has COVID-19 and this pandemic affected the work that you're doing? And what are you seeing in the field directly from these teens?
For a while, we really stop seeing patients on our mobile unit, right? We know that our partners and collaborators and these drop-in centers, all the numbers went down, and we understood from early on that this was a big impact for our youth, right? A lot of them had to go back to homes that were not supportive and not affirming of their care. A lot of them left the city, moved in with friends, etc. And while that was bad, we're starting to see a lot of patients come back. We have patients that we hadn't seen in a couple of years and are starting to show up again. It's like, no, I moved to Georgia with family and now I'm back in the city. And that has been really wonderful. I think one of the important things that we saw was, or that one of the important changes was our ability to do remote care, right? Virtual care. For a lot of our youth, that has been really helpful. We know that we work with youth. We know that our what we call our no-show rate, patients that are scheduled for a visit that don't show up, is a little bit higher than the rest of the clinic. That's not the case for virtual care. Actually, most of our patients are showing up just because it's so convenient and so easy for them to just jump on a quick video visit and take care of their care. So that has really helped us engage with some patients that were having a very hard time coming to the clinic. What we're seeing, I think we're seeing across the board, a lot of behavioral health needs. Patients are really, everybody showed great resilience, and I feel like everybody is just now exhausted and really kind of just looking for help, and that's what we're seeing, right? We had some staff turnover, of course. We are now, for the most part fully staffed, but even with our full behavioral health team, they're at capacity, right? So we have a lot more patients that need care than we're able to see at the moment. So that's been really
Hey,
challenging.
Yuri, could you talk a little bit about the importance of the van, though? Because I know for, during the shutdown, the van, of course, wasn't happening. But in the years prior, but particularly now that people are back out on the street, kids are hanging out on Christopher Street again, or wherever particularly homeless kids are congregating, they are very unlikely to make the trip to 18th Street to Callan Lord to take care of their health. So it's essential that the van be able to go where they are. Can we talk about that a little? Because I know that's specifically what Broadway Cares is very eager to always fund.
Yeah. And so, yeah, we have been providing those services forever. We really try to go where youth are congregating. It is hard to have people just come in. We park in places where we know there's youth, and we have great outreach coordinators that really engaged with youth that are out in the streets, and it's pretty difficult to have them come in. Our biggest our biggest our most attended sessions are when we work with partners that are already working with youth, but we do go to Christopher Street. We go to Streetworks that are drop-in centers. We go to HMI, that's also an LGBT drop-in center. We work with a center as well, and it is a great opportunity to introduce a lot of youth to our services. Oftentimes it's just a one-time visit where we can talk about HIV screening, and we can talk about STI screening, and we can introduce PEP and PrEP, and certainly when we identify patients that are living with HIV, it's an opportunity to link them to care. The desire to link patients to ongoing care is for all our patients, but it is certainly more important and a little bit more urgent when we have patients that test positive for HIV on our van.
And what are you hearing from these youth when they come to receive services? Obviously, they're coming. They wouldn't have access to this if it wasn't for the support of members here in this audience and from this van itself being there. What are you hearing from them on the streets, and what sort of reports? Obviously, they're coming for testing, but as well as testing, what else is available to them at these vans?
We provide all kinds of what we call low threshold services, right? So, we can't do many procedures in the van, but we can do some basic reproductive care. We do provide birth control. We certainly, we can do some basic blood work. We have referred patients to receive post-exposure prophylaxis. In some places, we have been able to actually prescribe pre-exposure prophylaxis PrEP on the MMU. And again, our patients a lot of them are asking for behavioral health resources. That is big. And
Yuri, can I interrupt you?
Of course.
Can you explain, because I'm not sure what behavioral health resources are to our guests?
Yeah, so psychotherapy and psychiatric services, both for medication and talk therapy. Yeah. Those are really what we're seeing. We have a large community of patients, obviously, that identify as trans, that are interested in starting gender affirming hormones. A lot of them, kind of reach us through the van. In the past, we were pretty engaged in the ball community, and we would go to youth balls and would meet a lot of patients there that were really hard to engage in care, that had very limited contact with the healthcare system.
I just want to say to our guests here, if you have a question of Yuri or Tom or myself at any point, please feel free to use the raise your hand feature. I want to make sure that you use this time to, if there's anything that comes to your mind that you'd like further clarification on, don't hesitate to use that raise your hand feature, and I'll call upon you to ask questions of Yuri. I just want to make sure, when you said you go to ball culture, I want to make sure that everyone understands what that is. I understand. I saw Paris is Burning. Tell me let's talk about the ball culture. Not only are you going to Christopher Street, but you're going to
Yeah, so the ball community, they organize balls and their get-togethers, where a lot of youth, mostly youth of color, um, it's really a space where they go to, um, it's a safe space, right, where they go to be with their colleagues and their peers and their friends and their mentors, where they can all have a good time and enjoy themselves. The ball culture has been around for a while, and certainly Paris is Burning is one of those posts. More recently highlights culture, and it was actually great to see a few of our patients acting in that series recently. And so, those are just a few of our many success stories, right? We have patients that came to us when they were homeless at 13 because they identified as trans, having to engage in sex work, that, as we've seen them age, become very successful in their lives in various ways. And so that is always really wonderful.
Yuri, we
Well,
have a question.
I always view the van as important too, because I think it's very challenging, disconcerting, and unlikely to happen for many of those kids to by themselves walk into a health clinic. I think it is a place that feels very unfriendly to them and threatening, and where they basically could put themselves in some kind of even legal danger. And to have the van go to the balls, to go to the pier, to go wherever they gather, allows the leaders of those groups to sort of make sure that all of them can feel safe in accessing the services there, which then may ultimately get them to the clinic on 18th Street or one of the subsidiaries. So in a sense, it's almost a version of harm reduction.
Absolutely. And that is our model of care, right? It is harm reduction in all aspects.
Yuri, Tom, I want to make sure we have a question from Maureen Keller. Maureen, please feel free to unmute yourself and ask a question of Yuri and Tom. Maureen, are you there? Hey, Ryan, if you could help Maureen, you can there's no unmute button.
All right, there it is. Hi, this is Maureen.
Hi, Maureen.
Hi, Maureen.
Hi, thank you for having us. I have just learned a little bit more about the importance of getting HIV positive, newly diagnosed HIV positive patients to their medication, and like that it's important for that to happen quickly. I just learned that after reading Jonathan Van Ness's book, actually, for the who read that. It's great. So how do you just kind of, what does that process look like? If you have a patient of any age that comes back HIV positive, what does that process look like for getting them treatment?
So I mean, we do have the, either patients that come and test here, that test in our mobile unit, or that test with any of our partners. A lot of them offer HIV testing as well, and they know to refer to us. When we have a patient that tests positive, that pretty much takes priority over everything else. We meet with the patient, even if it's briefly, obviously, to assess for their safety, make sure that they're going to be safe after receiving that news. We obtain baseline labs just to make sure that we have a baseline, and we will start patients on medications that same day. We will encourage patients to start medications. Some patients will not be ready and will not do it, but for the most part, our goal is to start patients on medication that same day. And again, thanks to the support that we receive, from Broadway Cares and our other partners, we have that ability, right? Our case managers will work with patients. Either they will get them enrolled in ADAP, which is like the state insurance for people that are diagnosed with HIV, where they can get their medication covered. Or they will work with the pharmaceutical companies to get their patient assistance programs, to get our patients enrolled in their patient assistance programs. And when all this fails, from our pharmacy, we give patients what we call starter packs. So even if it's just a few pills, while all that paperwork gets done, but our goal is to really do a quick start, right? To start our patients on medication right away, you know, and that's our first visit, right? We really touch base on the most important aspects. We assess for safety. We have a brief discussion with a patient about what being diagnosed with HIV means, and we start medication right away, and we plan for a lengthier visit in time. We also have our RN, our nurse, Phyllis, who has been with us for like 20 years as well, who is just amazing at providing education to patients that are newly diagnosed, and we'll make sure that they meet with her as well.
Maureen, thank you so much for that question. I think it's so important, from testing to immediate medication. So thank you for your question, Maureen. Yuri, I want to make sure that we have some time to touch base with some of our other guests, but we'll see you at the end of the program for a sort of round robin with everyone. So we'll see you in just a bit. Thank you for coming and talking about HOT program, and we'll see you in just a bit.
Thank you.
Yuri, thank you very much. Please
Thank
give my
you.
best to Wendy and Darnie.
Absolutely, and thanks again to Broadway Cares.
Sure. So next up, our second guest joins us from AH of Monroe County, based in Key West, Florida. She has been living in Key West and working for nonprofits for the last 20 years. She supervises an amazing frontline staff of nurses, case managers, and linkage coordinators who work with folks living with HIV/AIDS in the Florida Keys. Please welcome, from AH of Monroe County, Director of Client Services, Michelle Norwood. Hi, Michelle.
Hi, everybody. Thanks for having me, guys.
Yeah, sure.
Hey, Michelle, I hear it's a rainy day in Florida.
It's a rainy day in paradise, but that's this time of year. It's always like that. It seems like once a day we get some rain, whether it's the morning, the afternoon. It keeps the plants beautiful and happy. So we're okay with that.
Well, thank you for joining us. I just want to remind, thank you again, Maureen, for that great question. Our guests here, please feel free to use that raise your hand button, ask a question of Michelle or Tom or myself at any point, and I'll call upon you. So Michelle, AH of Monroe, let's start. Tom, talk about a little bit about the history of—
Yeah, sure. AH of Monroe has been a grantee of Broadway Cares, again, for a long time, since 1998, with the first grant of $5,000. And back when your name was AIDS Help, which is what AH stands for now. What does that mean now, Michelle, AH, as opposed to AIDS Help?
So a couple of years ago, we found that we were kind of getting a little bit of a disconnect, because the name AIDS Help, while we always want to acknowledge that AIDS and HIV is our primary focus, we have a lot of clients who are diagnosed with HIV who may never progress to having AIDS in their lives. And so some people were feeling as if AIDS Help wasn't a place for them. It didn't provide services for them because they were not, diagnosed with AIDS. So we were thinking about that, and it was also coming along at the same time that we're having this major housing crisis in the Florida Keys. Just in general, there's no place to build. It's a tiny island, Key West is, and so one of our main goals was to ensure that not only our clients, but a lot of folks who are disabled or older or struggling just with having housing were able to obtain that. So we put a lot of focus into affordable housing in addition to our work with HIV and AIDS. And so sort of made that designation at that time, hopefully to make sure that, everyone felt at home here, that this was here for everyone.
So Michelle, as Director of Client Services there, you have a huge piece of what you do is emergency response and emergency medical attention. What are some examples of what that looks like on any given day, any given week, any month there in Key West?
It's so interesting because I was looking at, sort of what we have provided with emergency assistance, and it boils down, especially right this minute, to the most basic needs that people have. because everyone is experiencing inflation here, especially. I know everyone lives in places where there's inflation, but between the inflation and the housing crisis here, we went from having studio apartments available for $1,200 a month to now they're about $2,000 a month. So in places like New York City, I understand that's not unheard of, but for here, it's a real struggle for people. And so when you look at the very basics of what it is that people need and what we've been doing on an emergency basis over these past, few months up to a year, the very basic issue is food. And for a lot of people, that's not a luxury that, that they have. Our case managers are always referring people to the, to make sure that they get whatever benefits that the state has. But our food banks down here in Key West have seen a doubling in the amount of people who are coming to the food banks to access, teachers, people, firefighters. There are, a lot of people are really struggling, not to mention our clients who traditionally, are having some difficulties financially. So one of the things that we've done was expanded our food voucher program. We purchased food cards from Publix and Winn-Dixie grocery stores down here. And we, for years, have been sort of assisting folks with a little extra, right? If you fall into the qualifications, you get a little extra each month so that you can buy some of the things that you enjoy. And when prices started going up, and I'm a mom, I have two kids, I have an 11 and a 13-year-old, right? And so as soon as prices in the grocery store started to go up, I was the first one, saying, hey, people are going to have some problems here. This is going to be difficult for a lot of people. And so one of the things that we did was expanded that program that we have to essentially open it up to any of our clients. Anyone who presents themselves here and says, hey, I'm struggling, I need some assistance with food, automatically, no questions asked, here, let us give you this additional, it's $50 per time they come in. It's not a ton of money, but it certainly helps when you're looking at your food bill and not seeing how you're going to make it work for the rest of the month. So that was one thing that was important to me, not making people come in and bring you documentation of why they're struggling or, feel like they had to sell their story in order to, because we just all know it's a fact. And so it's available to anyone, and I really enjoy that. And there are food banks and things, but I think there's a certain amount of dignity that comes along with being able to go to the grocery store and purchase the things that you enjoy or that, or that your family will enjoy, and not try to cobble your meals together from something someone's donated, although I am so grateful for those donations as well. So our emergency assistance, lately has really come in the form of those food cards, and people are grateful.
And realizing that without that nutrition, that their HIV medications, the antiretrovirals, any medication that they would be on would not be able to do its job. So you're working. It's
all linked. Yeah, it's all tied in there together. We use sometimes those food cards as a way to help people prioritize their health care, because we know that if you have to take off work for a few hours or sometimes even a full day, it's really hard when you're not in a job that has a salary and sick days and those kinds of things, to prioritize your health care if that means that you're just not going to get paid for a day's work. And so, we're able to use some of those food cards, not as paying people off for getting their health care or anything like that, but just to help cut some of that, some of the pain of missing out on, whether it's a few hours work or a whole day's work.
How are the clients you serve finding you, and how are you finding the clients in need in this time? I would imagine that the need is overwhelming. How do they find you, and how are you out finding those in need? Can you talk a little bit about?
Have you ever been to Key West? We're tiny. Key West is we're considered a rural area, right? Even though we have a really large population of tourists in and out all the time. Really, underneath all of that, we're sort of a small town, right? And the people who live here and the people who visit here, as a matter of fact, are very familiar with us. We've been around since '86. I was lucky enough to start working with AH in 2000. So I've seen the longevity. But if you were to ask anyone in town, where do you go if you need assistance and you have HIV? It's a pretty easy connection. And so they typically find us without any trouble. We find them with good relationships with our local health department, with our local infectious disease doctors. And so they know that if they have someone who's just new to town or is newly diagnosed, they pick up the phone, they call me. And again, small town, we drive over, we go where they are, and try to make that one-on-one connection with the person so that they know that it's not a big scary office building they have to figure out how they're going to get to, and all those things. We do a lot of we come to you kind of care, which is one of the things I love about working here. We even do HIV testing in a sort of we come to you sort of way. We get phone calls late at night, and I know because they come to my cell phone. We get
Tell me about some of those phone calls. Being the director of client services, I bet you have an intimate relationship with the majority of these clients. Talk about some of those phone calls that come in.
We have about 310 clients, right, at any given time. And I've been around for 20 years. So you're right. I have got some really great relationships with people I knew the first time I worked here. And people that I have just recently met coming back in the last 7 years. People, I hope, right, what people find on the end of the phone is someone who's non-judgmental, who will listen to whatever their particular need is, and then try to figure out ways to meet it, right? And it's one of the things I love about working in a nonprofit is you get to be creative. You're not stuck in little boxes, as long as you can figure out a way to fund it, you're not stuck in little boxes about what you can and can't do or how you can work with people. And so, it's very working for a small agency is beneficial in that way. So last week, we have a decent sized Haitian population in Key West, and I'm not sure if you know much about the Haitian community, but they really struggle with stigma, and it's a huge challenge to get them in the doors. And so if we're able to do that, we feel like there's a success there. So last week, I got a phone call from one of our clients who has been positive since 2015 and who's Haitian. And she said to me, Miss Michelle, I haven't taken my meds since January. I said, why? Why haven't you taken your meds since January? Tell me about that. And she said, I have been undetectable. Every lab test I've had for the last, 5-6 years says there's no HIV in my system. I don't think I have HIV. I think that this was a voodoo curse that someone placed on me, which is very common in the Haitian, culture. This was a voodoo curse. And so I, trying to be respectful of her beliefs, I said, okay, that's fine. But I just want to make sure that you're doing everything that you can to be educated, right, about your health situation. You said you haven't been taking your meds since January. Let's just have your labs drawn and see. And that way you can see whether or not there's HIV still in your system. And she was convinced that there was no need for this, but working in a small agency, I was able to call my boss and say, hey, I need to run an hour up the road, pick up this Haitian woman, this client of ours, take her to the doctor's office and make sure she gets these labs drawn. And so I did just that. And we had a wonderful chance to talk, and she was very convinced that this was what was happening with her. And of course, when her labs came back and she has a detectable viral load and her CD4 count had dropped, she actually wasn't going to go back to the doctor to even hear that information. So I get back in the car, I drive an hour north, I go pick her up and take her over, and whatever the doctor said behind the clinic doors, she walked out with a bottle of medication. And right, so it's those kinds of things, having the freedom to be able to do those sorts of things, to focus on one person at a time and say, yes, it matters, whether or not you're on your medication, you matter. Let me come show you how much you matter. So that's the part that I really enjoy.
Michelle, that was an extraordinary example of what client services is all about. Actually the intense personal connection and heart that you and others who do this job bring to providing these services to clients. You really are the connection between the organization and the individuals who have the most at stake. We
are old school in that way of thinking. I at least like to, that's how I like to think of it, because that's how we started. We started with, a small group of concerned people sitting around on somebody's back porch one day saying, hey, this is not okay. Our friends are very ill. Our friends are dying. How are we going to, to deal with this? And, at first their main task was sitting with people as they were dying. And so for me, who has the perspective of seeing what things were like in 2000, learning from my predecessors, seeing what things were like in 2000 and seeing what they're like today, that care for our clients is really care for our neighbors, it's care for our families, it's care for our friends. These are people, I have clients on our client list that I've known since I moved to town, regardless of their HIV status. These are our neighbors, and the best that we can go to them and make sure they're getting what they need. That's what makes me feel like at the end of the day, you've done a good job.
Well, thank you for that, for being that human in the world, for being that one-on-one, that person. And all that you do. You're remarkable, and thank you for doing that, for being who you are.
Thank you very much. We are so grateful for the grants and the gifts that we receive, because would I be able to be as generous with some nutritional assistance, with those incentives, if I was having to justify them every month to a large, contract manager or a large grant such as Ryan White? I definitely would not be able to do that. And so, having other funders, having other grants allows us to be outside of the box. It allows us to do those things that you just can't get, in other ways.
And give space for that one-on-one support that you just talked about.
Yep.
Michelle, thank you so much for stopping by, and I will see you in just a bit at the end of the program.
Thanks again.
See you in just a bit.
Right. Thank you, Michelle. And our third guest is from the Utah AIDS Foundation in Salt Lake City, Utah. He joined the Utah AIDS Foundation in 2021 as the mental health program manager. He's worked with Salt Lake City School District as a social worker, providing therapeutic services for high-risk youth. He has worked and volunteered within a variety of settings, including substance use facilities, the Utah Pride Center, and the Infectious Disease Clinic at the University of Utah Hospital Mental Health Program Manager. Please welcome from the Utah AIDS Foundation, Mental Health Program Manager, Drew Olson. Hey, Drew.
Hi, thanks so much for having me. It's good to be here.
Drew, so happy you're here. Tom, want to give you a little bit of backstory?
Let's jump into that right away. The Utah AIDS Foundation is one of actually our oldest, longest running, if you will, grantees, going back to 1993, which was actually a $2,500 grant. Since then, we've awarded over $170,000 to Utah AIDS Foundation, and literally just last Thursday, awarded them a $10,000 grant. The check, Drew, is in the mail.
Great, that's awesome. It's good to know. Thank you so much.
Sure.
What does this make possible at Utah AIDS and the work that you're doing currently?
Historically, the grants that have been made available to Utah AIDS Foundation have been utilized to help to make connections within client services. Very much like, my fellow panelists, these funds have been able to really be able to really support clients to have the services that they need when other avenues of funding are not available. And so right now, what's happening with the funding that we're receiving from Broadway Cares is we're able to expand our mental health services in this new program that we've been creating this year.
Talk about the mental health services, because the idea of mental health services feels quite large.
Mm-hmm.
Can you iris in a little bit and talk specifics about that?
Absolutely. So prior to me coming on board with the Utah AIDS Foundation, this has been a big dream for Emmer, who's the executive director, and Jared, who's the client services director. And they've been really noticing inside of our community here in Salt Lake that there's little to no cost mental health support to people living with HIV. There's behavioral health counseling that's available, and people who have insurance have maybe a few sessions that are available to them when they're able to access mental health. But as I'm sure many people know, mental health services there's a high need for them right now, and there's not a lot of support. And so this program is providing little to no cost mental health support for as long as people need it for. We create treatment plans and we follow through on those treatment plans, and people have access to therapy who historically have not been able to, which is really incredible. So as of right now, we're operating on grants that make it so that mental health services are completely free, no insurance is required. And in the near future, we're going to be on insurance panels so that we can bill for insurance to help to replenish funds within the program. But things like support from Broadway Cares will make it so that there's no copay that's necessary for us to be able to provide therapy, which is great.
So I would assume this is individual therapy as well as group therapy environments.
Mm-hmm. Yeah, so the way that the program is being built is right now we're really focusing on sort of micro level interventions, which means like one-to-one therapy. And because that was the greatest need, right? Something that came up during the pandemic is that there's just an increased amount of isolation that happened, where people who were maybe coping relatively well, with living with HIV or experiencing minority stress or just the general stress of life, they were doing well. But then with the added implications of isolation during the pandemic, we're really seeing some, it's a risk factor, right? We're seeing a lot of people experiencing elevated issues with mental health. And so that was the first priority. And then, expanding out to meso and macro level interventions is the next phase for the mental health program. And we're actually expanding our services to include another clinician so that we can see more people as well.
I would imagine as we all understand the importance of mental health, but how mental health intersects with a diagnosis or HIV/AIDS, the isolation upon isolation. Are there any individual stories, or, being this program manager, you have, I would imagine, a lot of hands-on. Are there any stories or people, protecting everyone's anonymity, that come to mind when you think of who has benefited directly from these services?
Yeah, just to kind of touch on that for a moment, a stark realization that I had when I started working with people living with HIV is that 64% of people who are diagnosed as HIV positive meet PTSD criteria. And so really providing trauma-informed care across the board at all levels of our agency is really important. And then also, really understanding the fact that the clients that I work with have experienced trauma on many different levels, and it's incredibly complex. And so with one particular client, obviously, honoring confidentiality, this person, like I said, was operating relatively, they were really functional in their lives prior to the pandemic. and they started experiencing these trauma responses after this like added layer of isolation started, you know, really impacting them in their day-to-day life.
What could a trauma response look like? What could a trauma response actually look like?
So a trauma response can look in a lot of different ways. Our mind and our body connection really make it so that these memories are stored in our nervous system. And so when we have external stimulus, like, you know, a situation like if you're out in public around crowds of people, or if you encounter a situation that reminds you of a traumatic event, you can really begin to feel like intense panic. And I have some trauma responses that are actually pulled up here that I'll just go through with you really fast. So common trauma responses are experiencing, you know, a loss of hope for the future, feeling distant and detached, or losing a sense of concern for other people, being unable to concentrate or make decisions, feeling really jumpy and getting startled easily at sudden noises, feeling on guard or alert all of the time, having dreams or memories that are upsetting that remind you of the traumatic event that you experienced, having problems at work or school, and avoiding people, places, or things that remind you of a traumatic event. And oftentimes when it comes to having a PTSD diagnosis, is that this is a complex condition where there's multiple layers of traumatic events that are contributing to this experience that you're having with your mental health.
Thank you for getting that clear on that, because I think we sort of intellectualize an understanding of what a trauma response is, but might not actually allow ourselves to feel that.
Right. And so with this one particular client that I'm working with, after he was, you know, really kind of confused and not really understanding what was happening for him, he thought he was just having like a bout of depression. As we were sitting, as I was doing the psychosocial assessment with him, I really just shared with him, this doesn't sound like depression. This sounds like complex PTSD. And so after doing some therapeutic intervention that's really trauma-focused cognitive behavioral therapy, and this really amazing therapeutic modality called EMDR, he's really being able to understand how traumatic events in his past are influencing his present, and he's seeing some really beautiful outcomes after engaging in therapy.
It's truly saving lives, I guess, you know, and in a very simple way, giving hope and creating a pathway to a healthy life.
Yeah, with this particular program, we really want to create a mental health program that's centered around the fact that we're not professional advice givers, right? We don't have the answers, but we want to help people to find the healthiest way possible to do what it is that they feel like is best for them. Because, you know, really, my own personal philosophy as a therapist is when I enter into a therapeutic relationship with a client, this person has really beautiful experiences that they've learned to survive, and being able to harness those strengths and those moments of resiliency to create new solutions that are relevant to them in their lives is really important. So self-determination is a really important aspect of our program.
You know, we talked to Michelle a little bit about the particulars of Key West, and then we talked to Yuri about being in New York City and the homeless teen outreach. What are some things that, and I think it's so important for everyone to know that the impact you're making in all 50 states is so huge. And so we have New York, we have Florida, and now we have Utah. What are some regionally specific challenges that you come up against? Stigma around mental health in the Utah area when you're doing this work?
For those of you who aren't familiar with Salt Lake or with Utah in general, we have a incredibly conservative majority in Utah, and there's a huge population of people who belong to the LDS faith, who sort of famously is not super supportive of LGBTQ individuals living their lives in a way that's healthy for them. And so, you know, oftentimes a lot of the clients that I work with experience this deep internalized homophobia There's internalized shame that people experience when they test positive for HIV. And it's coupled with this, sort of stress, religious stress that they've grown up with inside of their families. And that carries through people's entire lives. I see clients who are anywhere from 19 to 65. And it's a really common experience when you're talking to people about their life experience, that they're carrying this sort of religious shame with them. And so really being able to sit with somebody in that and to listen to their experiences, help them to feel connected to a community where maybe they've been distanced from their family members, estranged from them. Oftentimes family members have passed on and they haven't been able to really kind of reconnect with them and heal that relationship. Those are some really common experiences that I personally see within my work with my clients. And then really creating a space that's trauma informed and that's open and warm and accepting with people who are, inside that building and who are competent and ready to just step right in and be confident and care for somebody when there's a lot of fear, there's a lot of uncertainty, there's a lot of stigma that still exists in Utah when it comes to being LGBTQ or being HIV positive or a combination of both.
Thank you so much for that incredible work that you're doing and coming and taking the time to share it with everyone here today. I'm in awe of all of you and the work that you're doing, and so grateful for the members of our Angel Circle and Visionary Circle who support this work. And without your support, that one-on-one help, that breaking of stigma, that mental health would not be addressed in the way that it's being addressed so beautifully. I'd love to invite Yuri and Michelle to come back out. I want to be respectful of everyone's time. So hi, Yuri, welcome back. Michelle, welcome back. I think I would be remiss. I am deeply, deeply moved, as I'm sure everyone here is, by the amazing work you're doing and the direct service that members of our Angel Circle and Visionary Circle, through their support, are allowing to be possible. I would be remiss on Pride Month to not give an opportunity for each of you to say, what gives you pride about the work that you're doing? And talk a little, just quickly, we're at round robin of what's making you proud this month, what's making you proud right now about where you're working and the services you're providing. Do you want to jump in, Michelle? Anything coming to mind?
It's what we talked about earlier. I'm proud that I have a staff right now who doesn't hesitate to go when someone needs them. They don't hesitate to just go. They know they don't have to ask permission or get it okayed by anyone. So I'm really proud that we're all sort of the same mindset, that if there is somebody in need, we're going to figure that out, together.
Yuri, anything making you proud right now about the work?
I mean, I'm really proud that we're a safe space for all our patients. They oftentimes don't find these spaces elsewhere. And it's nothing is great than, even with a mask, being able to see their smile when they're like, yeah, no, you came to the right place and we're gonna help you out with what you need. It's really, really touching, and just really proud of that.
Drew?
For me personally and professionally, I think I feel really proud to be working with an agency that has seen so much change and who has supported people living with HIV since basically the early 90s, right? And I really honor my queer elders and my queer ancestors in my own personal life. And so being able to be a part of this new program and carrying on the legacy of providing care to HIV positive and AIDS defined individuals is really incredible. And one thing that I think is really exciting is that this week we are in the process of moving buildings so that we can expand our services to our clients. And so we're really on the path of becoming the first agency in Utah to provide comprehensive LGBTQ sexual health services to people who are in Salt Lake City and in Utah. So there's so many incredible opportunities that we're working to bring forward into the community.
Thank you all for the work you're doing, and to our wonderful guests here, members of the Angel Circle and Visionary Circle. When you hear Drew and Yuri and Michelle speak about these individuals and this impact of their work, that is your support. It's because of your support that this is able to happen. So thank you, Yuri and Drew and Michelle, for being here. Thank you to members of our Angel Circle. And I'm going to pass the virtual mic over to Tom, because that hour went by very quickly. I don't know about you, but that went by very quickly. I'm going to pass it over to you, Tom.
Sure. Well, thank you, Nick, for being such a wonderful moderator. And I want to be cognizant of our time together here and make sure we can all get on with our day and maybe get some lunch. Thank you, Yuri, Michelle, and Drew for joining us today. And I particularly want to thank the members of the Angel Circle and the Visionary Circle for sharing their time, their generosity of spirit, and their resources with us so that we can reach out to these 3 organizations and hundreds more to make a difference in the lives of hundreds of thousands of folks, as you heard so specifically from each of these individuals. And in the very specific work they bring to the outreach, that they bring to the end game of your support for Broadway Cares Equity Fights AIDS. I really take comfort in knowing that we all not only talk the talk, as we've done here for the last 55 minutes, but that we will continue for days and hours and months beyond this to walk the walk. So thank you all for being here, and have a wonderful Pride weekend.